Welcome to week 8 of the Washington DC lockdown. This city, in fact, is one of the few places in the US still to maintain a full lockdown, despite the urgings of the man down the road in the White House that states and cities should begin reopening as soon as possible. The pace of the reopening, in fact, is becoming one of the most fractious debates surrounding coronavirus. Some places are charging full speed ahead. Oklahoma, for example, is opening its nightclubs. Florida is opening its gyms. But we here in Washington, along with states such as New Jersey and Illinois, both places which have been hit hard by the disease, are still requiring residents to shelter at home. So far, the loudest voices urging caution as far as the pace of easing lockdowns goes have been America's public health scientists. People like Anthony Fauci, the head of the National Institute of Allergy and Infectious Diseases and a prominent member of the White House Coronavirus Task Force. He and other colleagues of his have incurred the wrath of the president by their frequent warnings of possible second peaks to come as states begin to reopen. This week, Robert Redfield, the head of the US Centers for Disease Control and Prevention, added his voice to those urging caution. He told us at the FT that he thought that there would be a second wave of the disease this winter in the US, as it is re-imported from places like Brazil and elsewhere in the Southern Hemisphere. He said this would be particularly bad, in fact, because it would coincide with the regular seasonal flu season. He also told us, worryingly, that his organisation still is not getting real-time data from states and from counties about cases, infections and death rates. This is worrying because as places begin to reopen, CDC needs to keep very close track of what exactly is happening to those infection rates so that it knows how quickly to move and whether in fact to put lockdowns or to recommend lockdowns once more. Interestingly, Dr. Redfield made his comments just as Mr. Trump is ramping up his aggressive tactics towards public health scientists. It will be interesting to know whether his warnings have come too late to change either public attitudes or states' policies.